So I suppose what I would say to somebody newly diagnosed, don't think that this is a life sentence. You know, and it's very difficult to pick yourself up after a migraine attack. If you've had 2 or 3 days or 4 days of a week and you're just getting back on your feet and it hits you again 2 or 3 days later and you're disabled again, and then you have to pick yourself up again, it's very hard to remain focused and to keep a sense of optimism, and I understand that. And that's where I think the patient organisations particularly have a real role to play. The other thing I would say to somebody newly diagnosed is inform yourself. Knowledge is power. And I think get to know yourself. So I would say the first thing you do is keep a diary. And you know, we're programmed to forget pain. There'd be no second babies in any family if we weren't. I'm convinced that we are programmed to forget pain. So keep a diary of everything that you feel pertains to that attack, what you ate, how much you slept, your fluid intake, all of that. And then when you look back, even in a month or 6 weeks, and if you're going to your healthcare professional, to your neurologist, to your GP, you can say, well, being female, that was a certain time of the month. I worked extra long days. I didn't sleep very well. I didn't have enough water. I was possibly dehydrated. And then you become your own detective. So, and that's very empowering, because if you're going to go into the sort of, oh, poor me, and there's nothing I can do, and I have this terrible situation, I understand that, but I don't think that's going to be very constructive, because I would really advocate for good self-management and good support. That doesn't mean to say it's easy. That doesn't mean to say that you can't feel downhearted and you can't lose perhaps some of your focus. But I really think that owning, you know, your own situation. So just maybe minding ourselves a little bit more. And then the other side of that perhaps is that we blame ourselves. And I know I'm always looking for a coat peg. Why did I have that? What did I do? Instead of accepting at some level that I have a neurological, biological disorder. That's the set of criteria I've been given. That's my lot in life. It can change, it can disappear, it can metamorphosize into something different, but this is what I have. Okay, maybe accept and act is what I would say. Accept, you've got a diagnosis, now what can I do? And then perhaps, and I'm not very good at this myself, but this is, I probably can say what I think is the more robust thing to do. And if you can, not blame yourself. Oh, I stayed out too late, I didn't look after myself enough. So learning to be a little bit kinder to ourselves.